Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're very glad you joined us. It's hard to believe, but we are celebrating our 10th anniversary on Health Matters radio program. We are planning some special shows to celebrate the milestone, so we hope you'll stay tuned. So let's begin today by thanking our sponsors, Studio Arts and Glass, and of course, our socially distant technical producer, J.D. DeAngelis. Joining me is Brad White, a compounding pharmacist, and our guest, Dr. Kelsey Kreuger, audiologist with Altman Medical Group. Good morning, Dr. Kreuger, and welcome to the show.
Good morning. Thank you for having me.
About 48 million people in the U.S. have some degree of hearing loss, but many of them struggle with acknowledging it. People may be embarrassed or ashamed about losing their hearing. Some see hearing loss as a sign that they're old, and some may like to ignore it or pretend it just isn't happening. They also might be worried of the cost of hearing aids or the way technology looks or functions. According to the Hearing Loss Association of America, the average American takes 7 years to seek help with hearing loss. This morning, we're going to talk with Dr. Kreuger about hearing loss and other issues that impact our hearing. We'd like to remind our listeners today that our programs are available on our podcast. Look for Health Matters with the Medicine Center Pharmacy in your favorite podcast app, and please subscribe.
So, Dr. Kreuger, welcome to the show again. Tell us a little bit about yourself, your background, and your training.
Thank you so much. Happy anniversary.
Welcome. Thank you.
Thank you.
So my name's Kelsey Kreuger. I am a clinical audiologist with Altman Medical Group. I have been here for about 2.5 years. I have my audiology doctorate from Ohio State University. That's where I also obtained my initial bachelor's degree in speech and hearing science. I have served on our Ohio Academy of Audiology board for the last 4 or 5 years. I'm currently a member at large. I have 2 children. So Henrik, who is 6 months old, and Charlie, who's 3 years old. My husband's actually driving back from his home state of Minnesota right now, probably listening in the car. And I'm from Canton, Ohio. So after my schooling and a few jobs, I wanted to come back to this area where I grew up and my family is.
Did you see the Ohio State football team come up on their buses yesterday? They were
Yeah.
practicing at the Hall of Fame field yesterday. So
Yeah.
I was going south on 77 with all these buses, these Ohio State buses. Where you guys going? You know?
Oh yeah, Buckeye fan through and through.
Yeah, for sure. So what is an audiologist, and what is the difference between you and other hearing healthcare professionals?
So an audiologist is really the healthcare professional, the specialist who specializes in hearing and balance disorders. We're who you're going to go see if you're having trouble hearing, if you have dizziness, if you have ringing in your ears or any concerns. We're the people that you should really be seeing. With an audiologist, now you're required to have a doctorate degree. So you have your 4-year bachelor's degree program and then your 4-year doctorate program. And the other hearing healthcare professionals that are out there, their specialty is really to test, fit, and dispense hearing aids. So they have a high school diploma, and then they go through a licensure or a training certificate program in order to fit and dispense hearing aids. So I'd say the biggest difference between audiologists and other hearing care professionals would be the amount of education and then also the scope of practice.
So as an audiologist, what kind of issues do you treat? Do you treat people of all ages, kids, adults?
Absolutely. So we're really the specialists who treat people from birth to death. The second that a baby is born, you have your universal newborn hearing screening in the hospital. And then if you need follow-up, we are the people that you're going to come see. And then also everybody in between. And then when you are older and you're having trouble hearing, we're also going to be the people you come see. We treat and diagnose people with all kinds of abilities. So no matter what your cognitive abilities are or your physical abilities, we see everybody. And then The treatment that we have is for all kinds of disorders. So tinnitus, hearing loss, sound sensitivities. Um, if you're going through chemotherapy, there's something called ototoxic monitoring. We will do prevention strategies for noise exposures and education for that. Um, and then something else called auditory processing disorder. So there's a lot of areas of audiology that we can help you with.
I didn't realize there were so many different things. I was just thinking about some common conditions you might see. And, I guess I think about the garden variety as we age, or if we have an injury, maybe what do we do about our hearing health? So is there anything else you want to throw in that basket that you just laid out?
Um, yeah, so there are definitely things that we see more often than others, and it depends on the practice that you're in. But we see a lot of hearing loss with age, sensory neural hearing loss, which is more permanent. There is, again, tinnitus, so the ringing in your ears, we see that fairly often. Wax buildup in your ears as well, that can cause temporary hearing loss. And there's also something out there called hidden hearing loss it's newer in the research, but it's fairly common. It's not necessarily something that pops up on your typical hearing screening, but it's there and people experience it.
Okay. Are you seeing a rise in hearing loss due to headphones or earpods or whatever you want to call them in younger people?
Yes, absolutely. It has been a big concern. And it's definitely something that the World Health Organization has actually been focusing some of their education on the last couple of years. I feel like everywhere we go, we see kids wearing headphones now and either streaming something or listening to something. And it's a huge concern because we want to make sure that they're not turning it up too loud, or listening to it for too loud for too long, because a lot of the damage that happens from these noise exposures is permanent. And then once they have this, it's not something that's going to repair itself at this time. So this is something that they would live with for the rest of their lives and not necessarily understand what they're doing to their ears. So it's definitely been a focus of ours as audiologists to make sure that we're educating parents and kids and teachers and anybody in their lives to make sure that this isn't a damage that they're causing that could have been prevented.
What are some things that parents could do to help prevent hearing loss due to noise in their children?
Well, the first one's pretty obvious, tell them to turn it down. If your child is listening to headphones and you can hear it, it is most likely too loud. I mean, that's just a golden standard. So if that's happening, turn the volume down. The other thing is try to eliminate some of the noise that they're around other than headphones. If you go to a wedding reception, that noise tends to be pretty loud. So maybe remove yourself from that situation or be prepared for it and bring hearing protection for them. Something that a lot of people don't know about, it has to do with cell phone technology now and like iWatches and iPhones. There are now notifications that you can enable that will let you know if you're listening to something for too loud for too long, or if you're in an environment that is too loud that could be potentially harmful for you. So I would encourage parents and people of all ages to go into their phones and see if they can activate these and check what levels they're activated at. It's called headphone notifications or noise notifications. And these are easy things that you can do that if things do get too loud on your phone, you'll get a little pop-up notification yelling at you saying, hey, turn it down. This could be harmful.
Back when we were allowed to go to concerts and things, I would take an app that would read the decibel reading to see how loud it was. And it was really interesting. So, but it was fascinating to see, whether you're in an enclosed arena or an outdoor arena, how things change. And I can't see how anybody who is in a band can even hear to think at this point in time. But I also know that some of them wear ear protection now too. So it's interesting to say the least.
Yes, absolutely. And I would encourage anybody who's going to be going to concerts, take that app with you. They're free on your phone. You have them on your iWatch. And that way you can monitor yourself in the moment.
Interesting.
So how about this? When does a person or a child, even child or adult, need to have their ears cleaned professionally?
I would say if you feel like you're plugged up, if your ears feel stuffy, you're full, or you're concerned that wax buildup has been a problem for you in the past, come in and we can take a look. If it's there, we'll clean it out. If it's not there, we might recommend a hearing test, just to see if there's something else going on that could be causing that fullness sensation in your ears.
Okay, very good. What about what's a garden variety visit look like to your practice? What can a patient expect?
So at our office, we really take time to look at the person as a whole, their entire medical history, any comorbidities or other issues that they have going on. We take a medical approach. A lot of people are familiar with hearing screenings, whether you've had them done at work or at your big box store in your area or at school. But a complete diagnostic hearing evaluation is completely different than what most people have experienced. So we're going to take the time to sit down with you. We will go through your whole case history. We will look in your ears with something called otoscopy. If you have wax in your ears, we will take it out for you. We want to make sure that there's no trauma to your eardrum. And then we'll do something called tympanometry, where we're going to take a look at how your eardrums are functioning. We want to make sure that you don't have any abnormal fluid or pressure buildup or anything going on in your middle ear. You also have something in your middle ear called an acoustic reflex. So this is a muscle in your ear that's supposed to contract anytime you hear a loud sound. It's basically a protective mechanism for your eardrum. And we want to make sure that that's responding appropriately and at appropriate levels. After that, we might do something called an otoacoustic emissions test, OAEs for short. And these are underlying sensory cells of your ears. They are what help you to detect really soft sounds of speech, but they get damaged very easily just by time, age, noise exposure, all kinds of things can contribute to the wear and tear of these cells. So we'll measure those and check the integrity. After that, we'll go into a more traditional hearing test where we'll test to see how you're hearing through both air conduction, listen for a beep and push a button, and something called bone conduction, where we're going to make sure that those bones in your middle ear are working the way that they're supposed to. After that, we'll do some testing where you repeat some words for me. We want to make sure that you have the ability to hear speech clearly and that it's not muffled when it's at an appropriate volume. And then we'll do some testing in background noise. We want to know how softly you can hear beeps and how softly you can hear speech, but we also want to check and see how you perform when there's lots of noise going on in the background, since that tends to be one of the areas where people notice the most difficulty. If it's appropriate, after all of that testing, we might have you complete a few questionnaires, whether it be about your hearing and how you're doing in certain environments, or your tinnitus and how that's affecting you. And then we'll do a comprehensive review of your results. So we're going to go over everything right there in the office with you, show you what's happening, let you know what we think's going on, and then provide any recommendations that we might have. If you want, you can come back on another day and we can go over everything with family and talk about your options. But you'll know what's happening or what we're thinking on that same day. So there's a lot that we do and what goes into a diagnostic hearing test.
Very interesting. We have to take a break here. You're listening to Health Matters with the Medicine Center Pharmacy. Welcome back to Health Matters with the Medicine Center Pharmacy. Brad and I are talking with Dr. Kelsey Kreuger from Altman Medical Group Audiology about hearing loss. So, Doctor, how can earwax affect hearing? Are there long-term issues to wax buildup?
Hopefully, a lot of the issues with your wax buildup is temporary. People might notice that their ears are feeling stuffy, plugged up. They feel kind of full. They might notice that a ringing in their ear has started, or they can kind of hear it moving around. So it can kind of click in there if it's starting to move around, or it's itchy.
I thought it was wax.
Yeah.
What's it doing moving around?
Yeah, depending on the consistency, everybody's wax is different. So some
Okay.
people have real dry wax. Sometimes it's more of a wet wax. But if it's really dry, they can hear it kind of moving around, and it's strange. But the good news is that if you do have a wax problem and that's your only problem, once we take that out of your ear, you will feel so much better and your hearing will improve and that sound goes away. So if you're concerned that that's going on, come in, because it could just be an easy wax problem.
Okay, people are sticking all kinds of stuff in their ears to clean their
Oh,
ears out, from a paper clip to Q-tips. And some of the stuff I've heard over the years is pretty amazing.
yes.
What's your thoughts on this?
You know, I get concerned when my patients tell me that they're using like a pen cap or a long fingernail that they save, or all
Geez.
kinds of strange things. Because the biggest issue is that we're worried you're going to cause more trauma to your ear. Um, I don't mind you trying to clean out your ears on your own, but the issue becomes we're worried you will rupture an eardrum because you've put something in your ear too far, or you end up actually pushing the wax in further and making it harder to come out on its own. So ideally, don't stick anything in your ears. If you just have to, just use a washcloth or something right around the outside of your ear canal. And then we'll take a look when you come in to see if anything needs professionally removed.
One of our staff a little while ago had a Q-tip in their ear, sticking out of their ear, and the child came by and whacked it and perforated her drum. And so the
Yes.
little kid looked at mommy and said, "Mommy's gonna die."
Oh my gosh, that's traumatic.
I know. I think and she laughed about it. Okay,
Oh,
whatever.
that's scary, but that is a real concern. People
Yeah,
will be cleaning their ears with Q-tips and they forget it's there, or they go and put the
yeah,
phone up to their ear and they push it straight through, and then you've caused a huge problem,
yeah.
because you could injure the bones in your ears, and depending on how bad the trauma is, you might need a surgery to fix it. So please don't do that. Your public service announcement.
Yeah, okay. They use Q-tips for all kinds of stuff, and I'm thinking that's the wildest story I ever heard. So, little boys,
Unfortunately, it
little,
happens.
yes. So, how about hearing loss in adults? And can you talk about hearing loss over time?
Yes. So this is probably the most common issue that we see in our office, and the technical term is presbycusis. So this is a hearing loss that happens over time just due to aging of your auditory system. It tends to affect both ears pretty equally because your
Hmm,
ears are on the same head that's whole life. So
yeah.
unless there's a trauma to one side, like Q-tip eardrum damage, you really should be hearing the same out of both ears.
Hmm.
Um, and then it tends to get worse as you age, but sometimes it stays the same for a long time, and then we slowly see it happen. It tends to be pretty gradual. So it might be something where you don't notice it's happening. But if you had normal hearing today and then you woke up tomorrow with the hearing loss that you have now, it tends to be pretty dramatic how much loss has happened.
Um, just as a benchmark, what kind of percentage of the population is born with, shall we say, limited hearing or not perfect hearing, or do we know those numbers?
Well, it's much smaller now. A lot of the people who are born with hearing loss had it as a side effect of like meningitis, or birth defects, due to illnesses and things like that. So now that we have treatments for those things and immunizations, that doesn't happen as often, but it still happens.
I guess we have to take another break here already. We must have run too long in the first segment. So you're listening to Health Matters with the Medicine Center Pharmacy. Again, you're listening to Health Matters with the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. This morning, we're talking with Dr. Kelsey Kreuger from Altman Medical Group Audiology. And we've got a lot more to talk about today. And we also want to mention that all of our stores have Janssen 1-dose COVID vaccine available for immunization. So, Doctor, are there steps people can take to minimize hearing losses when in a crowded or loud areas? I mean, like on West Tuscarawas Street here, where all the ambulances go by and the fire trucks, and you can't even stand out the sidewalk without
Yes.
covering your ears.
Yes. So if you're having issues hearing when you're in background noise, there are a few things that you can do without having to buy anything. If you have the option, turn the music down or turn the volume down. Oftentimes that's not something that you have control over. So if you can distance yourself from the sound source, if you can call and make a reservation at the restaurant before you go and say, seat me the furthest away from the live pianist or the band that's playing, that's always a good option. I guess that's more pre or in post COVID, since we aren't going out to restaurants very often right now. And then if you can try and situate yourself somewhere that has good lighting, you might not be somebody who lip reads, but you actually do get a lot of information from what somebody is saying just by getting visual cues from their face and looking at facial expressions. And then there's also some hearing protection out there that's available that is filtered. So it might be filtered for different environments. There are filters specific for music or hunting or work environments. So depending on the environment that you're in, certain hearing protection devices might allow you to reduce the background noise so it's not so loud and bring it into a safe listening level. And then still allow you to hear the speech clearly.
What about tinnitus? Can you talk about tinnitus? And
Yes.
how do we manage this? I've got a friend who's had it all his life and has probably tried every remedy in the world.
Yes, it's very common. It affects about 15 to 20% of the population. Um, and there's a lot of things that can cause it. So what I'd recommend is first have a hearing test, a diagnostic hearing evaluation, so we can kind of guide you as to what might be the cause and figure out why you have it. It could be as easy as wax removal. That can take it away. But sometimes it is a side effect of having noise exposure and having hearing loss. It just depends, but sometimes it's a sound that people hear. It can be ringing, buzzing, humming, it can be music, and there's really no external sound source. So nobody else hears it. You just basically hear it. You can hear it in your head, you can hear it in one ear over the other. It can vary, it can fluctuate in intensity or pitch. So we see a lot of variation with tinnitus, and there's not necessarily one treatment option for it. So we really need to get to the root of what the problem is, and then go from there.
I had a discussion yesterday with a veteran who has Menieres.
Mhm.
What's the relation with that in the hearing and dizziness and all that sort of thing?
So Meniere's is one of the trickier otologic conditions. It presents differently for pretty much everybody who has it. Um, a lot of the main conditions that they have when you get diagnosed with Meniere's is dizziness or vertigo, room spinning sensation, tinnitus, ringing, buzzing, humming, fullness in your ears, and hearing loss. It tends to happen in one ear. It's not usually in both ears, but you get episodes. So let's say that a storm is coming in and the pressure in the air is changing. That might trigger you to have an episode of dizziness or your ear feels real stuffy. Now, there are sometimes surgical treatment options for this. So I would encourage you to reach out to a neurotologist or an ENT, ear, nose, and throat physician, to really see if that's something that you're having and experiencing, and if there's a treatment option as far as surgery goes for you. Sometimes hearing aids can be beneficial. So definitely getting an evaluation to see where you stand can be helpful.
Is there any connection with Meniere's and vision?
Not necessarily. Sometimes when you're experiencing these episodes, you might feel like you're not seeing as clearly because your room is spinning.
Sure.
You're getting that spinning sensation. So you might also experience some migraines, and sometimes those affect your vision if they're ocular migraines. There's a lot that goes into Meniere's disease. It's not always a one size fits all answer for that one.
Okay. This was a very interesting discussion because this was a veteran who was in Afghanistan and came back with that disorder. So
Meniere's is very difficult and it can be very debilitating. So there's definitely help out there. You just need to make sure you see the right people.
okay.
So what about this? I've heard of people who say they hear music when music isn't really playing. What could cause that?
So that's a different version of tinnitus, actually. Typically, it is a random melody or a jingle that you've heard, and it can just play over and over again in your ears. Sometimes it's called musical tinnitus or musical hallucinations, musical ear syndrome. You are not going crazy. This is a thing, it happens. I would definitely have your hearing evaluated to see if anything can be done for your version of tinnitus to make it less noticeable.
So it's not your braces.
No,
Getting
no,
radios.
Hey, a while ago, it was the amalgam that they used in your teeth, and occasionally there was a person who came out and said, "Well, I'm hearing station WXYZ or something like that," and so they determined that it was the amalgam that they used to use for filling your teeth.
Well, let's hope it was WHBC, right?
Yes, of course.
There you
Listening
go.
to the program.
All right. So what are some common signs of hearing loss and when should someone seek treatment?
So, common signs of hearing loss that a lot of people experience first is going to be increased need for repetition. You're asking what or huh fairly often during the conversation. Um, Other things could be turning the volume up on the television or on your cell phone, opting for closed captions when you're watching TV. Um, Sometimes you misunderstand what people say and you don't follow along with the conversation as easily as you wish. Again, tinnitus in your ears and fullness. Fullness is sometimes a side effect of hearing loss. Um, I would say if it's interfering with your ability to communicate and hold conversations with friends and family, if it's causing arguments, if you are frustrated with it, um, then if you feel like you're missing out on conversations and family gatherings, definitely just come in and have your hearing tested. You don't necessarily have to walk out the door with hearing aids. It might just be peace of mind knowing what's happening and that you do have a hearing loss that's just beneficial for you.
All right. Well, let's talk about hearing aids for a moment. Can you tell us some of the newest technology and how you can manage the settings from your smartphone or smart TV?
Yes. So hearing aids are constantly evolving. There's a lot of research and development that go into them to make them smaller, sleeker, make them smarter. So a lot of hearing aids now are rechargeable. So you don't have to fiddle with batteries anymore. They are Bluetooth compatible. So anything that has Bluetooth, you can pair them to. That being said, you can pair them to a cell phone that has Bluetooth or your smart TV that has Bluetooth and wirelessly stream your television signal, your phone calls, music, podcasts, radio, anything that you would play from your phone or your TV, you basically could stream to your hearing aids. And there's also apps available now for a lot of hearing aids. So instead of sitting at your ear trying to manipulate buttons, you visually see it on your screen and you can just adjust volume there. You can adjust programs and check your battery life. It's just meant to be easier and smarter.
It's amazing.
Mm-hmm.
So how about cochlear implants? Our famous radio man who's no longer with us, Rush Limbaugh, was one who championed that device, and that's the first I guess I really had ever heard of it.
Yes.
And I ran into a fellow the other day who just had one done in university in Cleveland.
Yes.
And I was surprised at how involved it was to get it in there and whatever. What can you tell us?
So cochlear implants and hearing aids are very different. Um, a hearing aid is basically it's an acoustic signal. So it's amplifying what you're hearing from my voice to your ears. So that is basically helping you if your ear has damage to it and you just need some volume. Um, a cochlear implant is going to be an implanted device that helps you if hearing aids are no longer beneficial. So if you're somebody who wears hearing aids and no matter what we do, we just can't get clarity anymore, they're not clear for you, then you might be a cochlear implant candidate. And a cochlear implant is an electrical signal. So we're basically bypassing the damaged ear and no longer stimulating the ear through an acoustic signal, we're stimulating through an electrical signal. So
Is it clear or like you and
yes,
I are talking right now?
that's our goal. So ideally, what would happen is that with time, we're going to retrain your brain to hear through the electrical signal through intensive therapy and consistent use. So it is not something that happens overnight. It happens over a period of days, weeks, months. But ideally, you're going to be hearing significantly better than you did with hearing aids through the cochlear implant. And it's very amazing.
Again, I've pushed us through the commercials. You're listening to Health Matters with the Medicine Center Pharmacy. Okay, we're back with Health Matters with the Medicine Center Pharmacy, and we're talking with Dr. Kelsey, Kreuger from Altman Medical Group Audiology. So we're running short on time. We got a lot more to talk about. Why do hearing aids cost so much?
Great question. Hearing aids are a big investment. Everybody knows that. They are meant to last you for 5, 6, 7, 8 years. They are basically two little computers that you are wearing on your ears all day, every day. So they are constantly analyzing your environment and adjusting without you having to do anything in order to provide optimal listening for you. So they are really smart. They are really small. These computers, well, the manufacturers of these computers spend hundreds of $1,000,000 every year to try and make them smarter, sleeker, smaller, to try and stay ahead of the curve with technology. But that's just a small part of it. You know, the hearing aids themselves and the technology itself is very expensive. But you're also paying for professional fees. You know, you can buy a hearing aid all over the place nowadays. But part of the important thing you have to consider when you buy a hearing aid is who is going to be fitting it for you and what kind of service are you receiving? Are you receiving professional services from somebody who has the education behind them to make it a successful fit? Or are you going to just try and get the cheapest option out there and then have it sit on your dresser drawer and be dissatisfied? So there's a lot that goes into a hearing aid dispensing. I wouldn't necessarily make a purchase of a hearing aid based on cost. You can come into the office and have a consult without having to pay for that, just so we can talk about your options and you can get a realistic idea of what you'd be expecting.
So what if I only want one hearing aid?
So it depends on what your hearing loss looks like, what your anatomy is. Oftentimes, 2 hearing aids are recommended because you hear best with 2 ears. You're actually hearing with your brain, and your ears just have damage to them. So you wouldn't want to send a signal up to the brain from only one side. You would want the signal to come from both sides. So oftentimes 2 hearing aids are recommended. But based on your audiogram, your hearing test, and your ear anatomy, sometimes only 1 hearing aid is necessary.
So you're getting a mixed signal. Is that what you're saying? Or didn't I say that right?
Well, possibly. With your brain, you know, you get a lot of cues from both sides. 2 ears are what help you hear when you're in background noise. They help you be able to tell where sounds are coming from. They help you with volume. So if you're only getting that signal from one side, you might not perform as well when you're in a restaurant setting. You might not be able to tell where that loud noise came from. You might feel kind of lopsided because all the sound is coming in from one ear when it really should be coming in from both.
Adjustment time with a hearing aid difficult?
It's not necessarily difficult, but it is time intensive. Hearing aids are not something that you just put on your ears and you walk out the door and we never see you again. It takes time for your brain to adjust to hearing aids. You know, hearing loss typically occurs gradually. So we gradually give you your hearing back through hearing aids. We don't want to throw all of the adjustments at you on day one, or it's very overwhelming. So it's a process. You know, we have to retrain the brain how to hear these sounds that it hasn't heard in a long time.
And so, most common problems with hearing aids?
A lot of people hear feedback or whistling. You know, you might be somebody who sat next to somebody else and you
I've
hear their
heard it,
hearing
yeah.
aid whistling.
Sure.
That could be as simple as wax buildup in their ear that's causing a feedback loop. It could be a poor fitting hearing aid. There are a lot of things that we can do to eliminate feedback now and to make it better. So if you're somebody who's experiencing that, definitely seek out help from your audiologist. Um, Nowadays, we're seeing some issues with masks because
Can't
you have
understand what anybody says.
you can't understand what they're saying, and we are asking our ears to do a lot. We're asking them
Exactly.
to hold our hearing aids, hold our masks, and hold our glasses. So it's a lot going on up there.
Amazing.
Are there other alternatives to devices than hearing aids?
Sure. There are things to help you with your TV. They're like TV ears. So they're basically headphones that can stream the TV if that's a situation that you're having trouble in. There are other things out there called pocket talkers. They're basically amplifiers, little microphones that you can have somebody else hold, and you wear a headphone that would amplify their voice. So there are things out there to help you if hearing aids aren't an option for you.
Okay, the $1,000,000 question. For those listeners that have loved ones who they believe are hard of hearing, how do you breach that subject and try to encourage them to seek a consult without maybe ending familial relations for the end of time or something like that?
Absolutely. I consider myself a counselor most days for families. The big thing for families is to remember to be patient and understanding and kind. Hearing loss tends to affect the whole family unit, not just the person who has it. So if somebody is struggling, don't just yell at them and raise your voice for them to hear you. Talk slower, talk at a slower rate so that their brain has a second to analyze what you're saying. Make sure you're face to face with them so that they can see you. Try getting their attention first. So say, hey, Kelsey, before you start initiating the conversation so that their brain is prepared to listen, because oftentimes people will miss the first part of what you've said. And something else that I found helpful is if they ask you what, and they ask you to repeat what you've said, instead of getting angry and rephrasing and phrasing it the exact same way, rephrase it, say it a different way so that if they didn't catch it the first time, maybe they'll catch it the second time with different context clues. Um, and then and then just slowly, people who have hearing loss have to be ready to come in and seek help. If they are forced in, they're not going to be as acceptable to help. So just talk to them about how it's affecting their quality of life, what they could do better. Hearing loss tends to lead to isolation and depression, and we don't want that. So if they aren't able to participate in the conversations anymore and they're missing out on their family gatherings, make that the important aspect. Tell them that, maybe you can hear better and you don't have to feel so frustrated. And then see where you're at. Come in and we'll do the test and let you know what your options are.
Well, Kelsey, why don't you give our listeners your contact info and where they can get more information from your practice? So before we wrap up here.
Sure. So we're the Altman Audiology Medical Group. We are off of Whipple in North Canton. Our phone number is 330-433-1450. My email is just my name, kelsey.kreuger@altman.com. And we have a website as well, so you can seek out our information through the Altman Docs website. And if you have any questions or concerns or need a second opinion, we are more than happy to meet with you and speak with you and help you.
Excellent. Any last minute piece of advice you want to leave with listeners who think they might have hearing loss?
If you're uncertain, just come in and get a baseline. You know, it's never too early to just get a baseline and see where your hearing levels are. Even if you don't find something, we'll have something to compare to down the road. So if you have any concerns, whether it be hearing or tinnitus or balance, or you have hearing aids and they're not working for you, schedule an appointment and we can go over what we can do to help improve your quality of life.
We're
Excellent.
out of time. We need more time. We always need more time. Okay. Thank you very much, Dr. Kelsey Kreuger, audiologist with Altman Medical Group Audiology. We'd like to remind our listeners, if you suspect you have a medical issue, please contact your healthcare provider. Thanks to Studio Arts and Glass, and of course, our technical producer, JD DeAngelis. As always, we thank you, our listeners, for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week, and we'll see you right here again next Friday on News Talk 1480 WHBC.